the way and the leadership skills that they learnt along the way, it is that that has made them what they are today. The Ungana project was based on our LVCT Health Timisha capacity building model, which is a model that, in addition to the technical expertise and organizational system, pays a lot of attention and investment on mentorship. And our mentorship is based on ensuring that it's done across the organization. So from the director of the organization to the accounting staff to the programmatic staff, all of them are involved in a process of mentorship in which they are linked up with people in our own organization who are doing similar kind of work, so that in a very safe space they can learn from each other. But we also learned a lot from having gone through this process. It's not only the 11 organizations we are celebrating that learned. We ourselves also learned a lot, not just about capacity building, but even about the way in which we work in partnership with others. And those who worked in the program directly will tell you it also calls for, besides technical expertise, it really does call for a lot of soft skills to be able to grow organizations from where they were to where they are today. Some of them started with funding of 40,000 Kenya shillings, and by the time they are finishing this project, they are receiving funding of 6 million shillings. That's a huge achievement, isn't it? Let's clap for them. And in the 5 years of this project, we sub-granted more than $500,000 to these 11 organizations collectively to do what they do. And so for us, it's a great honor to have been the capacity building partner for the 11 organizations. It's a great honor for us as an organization to be associated with these 11 organizations, that everywhere they go, they will mention our name as well. We are very proud to be associated with them. And everywhere we go, we will also mention their name, because we not only have a partnership of organizations, but we made friends in these organizations whom we will work with in continuing to respond to HIV in this country. And it's our hope that what you learned from this capacity building program is going to be sustainable. Although the Ungana project is coming to an end, the LVCT Health Capacity Building Program is not closing. We will continue to grow other organizations. We will continue to work in partnerships and generate resources where we can to ensure that local organizations are able to compete and to have an equal chance with the strongest of them in this country, in all the areas of HIV. So we hope that you will continue to implement the programs you are implementing, and we hope that you will, we are sure actually, not we hope, we know that resources will follow you, because you are strong organizations with good systems, with good leadership, and with technical expertise to be able to attract the resources to continue the work that you do. LVCT Health will continue its commitment to investing in growing local organizations. In Kenya and beyond, we have implemented capacity building utilizing the same model in various other African countries, including Botswana, where we've had a long 5-year relationship with an organization there and with the Ministry of Health. We've used the same model in Ethiopia, in Uganda, and in the future we intend to extend our capacity building program to other African countries who can benefit from our own experience. And so I want to thank you very much, the 11 organizations, for your patience with us when times were tough, for your ideas that you brought to grow the capacity building program even beyond what we had thought, and for what we learned from you as well during these 5 years. And I want to thank our donors. This program was funded by PEFA through CDC, and I want to thank CDC very much for that funding, but also for the technical support that they gave to us and to our sub-partners during the implementation of this program. I also want to thank the government through the Ministry of Health, and particularly NASCOP and NAC, with whom we have worked and continue to work very closely in the work that we do as an organization. I want to wish the 11 organizations very well as you continue with the work that you do and in making your mark in contributing to the targets towards zero in this country. So thank you very much. I also would like to just acknowledge the staff who have been involved in this project and to thank them very much. I know we will continue to thank them as we go on with the program, but there have been staff who have been dedicated for a long time to this project. Some still at LVCT, and I can see a lot of our former staff here who are working with the Ungana project. Thank you very much for your contributions. It's the foundations that you laid that have enabled those of us who have remained to continue working on the Ungana project. And with those remarks, I would like now to invite our chief guest, Dr. Bathsheba Osoro, to deliver her remarks.
Thank you very much, Dr. Wanjiru, CEO, the Director, LVCT Health, distinguished guests who are around, the Ungana brothers. I want to give them a new name because they have done very well. Thank you very much for this great occasion that I've come to represent NAC. I wish just right from the beginning to give an apology of our Director, National AIDS Control Council. I'm sure I would have loved to be with you this evening because she knows the beginning of the Ungana project more than I do. But this evening, I'm happy that I'm here representing the Director, National AIDS Control Council. And coming from the National AIDS Control Council, for all of you are around, I know that you know that the National AIDS Control Council has a mandate in this country to coordinate the HIV and AIDS response. And since today we are here to celebrate, I'm very excited to be part of you. I'm very excited to be part of this occasion, especially because of the historical background that I would really want to talk about this as we celebrate this occasion. The HIV and AIDS response, we have come a long way as a country. And when you mention the issue of capacity building, then it takes me back to where we started as a country in our HIV and AIDS response. I remember in 2000, when National AIDS Control Council started an operation to coordinate the HIV response, we were able to get resources. I just want to give you a bit of background. We were able to get resources. And one of the biggest challenges that we faced as a country is capacity building. Why am I saying that? Did you used to hear of briefcase NGOs? Yes. And I listened to the words as our Master of Ceremony and as the Director mentioned about credible NGOs. And I caught that word straight away. Because having been in NAC at that time, I know that as a country we are ready to respond to HIV and AIDS. And we got resources. You remember what we were calling the CADREP, the Kenya Disaster Response Project, where we got over 50 million, was it US dollars? And it was now our responsibility as National AIDS Control Council to coordinate the response by mobilizing our communities and organizations and CBOs, NGOs who are formed in the communities. And I recall one of the biggest challenges that we are actually having at that time is to have organizations that had the capacity to respond. And so when you mention about the celebration you have today, I link it a lot with the beginning of the HIV response in this country, where we did not really have many organizations that had the capacity to respond, the capacity to utilize resources. And for me, this invitation, when the director passed it on to me, I said, this is a great occasion. And as I entered, I said, wow, these are great people, great Kenyans who are doing a great job. And I want to congratulate you. I did want to thank Liverpool Health for the kind of work that you have done. As I listened and as I watched, now the problem you did is to bring on board somebody who has been in this response for over 14 years. I said, for sure, this is great work. And you have a reason to celebrate, because you have built a capacity that is going to move this country forward. In the national HIV and AIDS response, and I know many of you have been there for a long time, we have been able to achieve a lot in this country. And this has been achieved because of the partners like Liverpool Health and many others that have been able to support in the various capacity needs of organizations. I did want to say one of the challenges that we faced, especially earlier on, not so much during the tour, but earlier on in the HIV response, is that many organizations got money with good intention to implement programs, but the challenge they were having, they did not have organizational capacity. The issue of leadership of those organizations was a big challenge. The issue of technical capacity, the issue of reporting, the issues of accountability. Remember, as we did as a country, as we did our report over the cadre project, one of the biggest problems at that time was the issue of accountability, because organizations had gotten money, many of them did not have the capacity to implement, many of them did not have the capacity to account. And listening to what you have done through Liverpool Health VCT, Liverpool Health, you have been able to get local organizations build their capacity and they are able to deliver. And that is a great achievement that we are here to celebrate today. And so the Ungana brothers, as I'm trying to, I'm seeing, and the sisters, you know, if I say brothers, they might think I've left out the ladies who are in those projects, in those organizations. In using local organizations to build the capacity of our younger organizations, to me, I say, is a great work that has been done by LVCT Health. I would again take you back to when we started the national the response in this country. There was that thinking that a few big organizations could be identified and then they could be used, funded, to be able to assist the other organizations to build their capacity. There was a lot of resistance on that. But I love the openness with which now organizations can realize that we don't have the capacity. We can depend on our big brother, who is Liverpool Health, to be able to build our capacity. And so for the 11 organizations that capacity has been built by Liverpool Health, these organizations are going to do great things in this country. And the reason why I'm totally convinced about that is the National AIDS Control Council. We have been able to work with Liverpool Health, and we know the kind of capacity that they have been able to build, even within the organization itself and beyond. And let me even not talk about the organization itself. Now our director, National AIDS Control Council, comes from Liverpool Health. It's excellent. And I can assure you, we are totally proud of her. I cannot hide, she's driving us to the right direction. It speaks from where she has come from. It actually tells you a lot, the kind of focus that she's giving us, the kind of direction that she's giving us. It only says what Liverpool Health can do to others. And I'm so glad that CDC, of course, the funds that they got from PEPFAR, they were able to support Liverpool Health, and they were able to support the 11 organizations who have now come to celebrate this achievement. And this is just the beginning. I like what Liverpool Health said. It is just the beginning. Why has your capacity been built? Capacity has been built so that you move forward and change the situation in this country. I would say that as a country we have made achievement here. We are at 6% now, but our concern is the new infections in this country. And you already know through the county profiles that we have given, and I'm glad that we are coming from various counties. We already have counties in this country, 10 of them, that contribute to 65% of infections, new infections in this country, and the highest new infections. If you are in those counties, I can see you can also be able to build the capacity of organizations in those counties to be able to respond. So I'm so proud of this work that has been done, coming from the National AIDS Control Council. I know you have been able to build a capacity of organizations that are going to help us to move towards zero. You know, our concern now is that as a country, we really need to reduce HIV new infections in this country. We know the more we put people on ARVs, we have more and more people staying alive and leading a good life, and so our worry is not on the preference, but on incidences of new infections that are in this country. So capacity building here in various aspects, I think, will help us to be more accountable, to be able to, once we get resources, we are able to effectively utilize the resources, we're able to report, and we're able to contribute to getting to zero. So that's why I'm totally excited about this. When you say we have come to celebrate, for sure we have come to celebrate. Because these great organizations that you have been able to, Liverpool Institute, you have been able to build the capacity, are moving into the counties, because I could hear they are coming from various counties, and they are likely to make an impact. We are going to have organizations that are credible, that will receive resources, that will be able to account for the resources, that will have the technical competence to move the war against HIV and AIDS into a better ground where we get to zero, and supporting the programs and various projects that come up in the counties so that we can make a difference. At the National AIDS Control Council, currently, you know that we have been developing a strategic framework and not a plan. Because now we have counties, we cannot impose anything on the counties. We can only broadly guide them on how to develop HIV and AIDS programs. And as we develop the strategic framework, and I was glad to hear that some of you have been involved in that, we are able to come up with what we think works best, what can help these countries to move forward. And with the capacity build, or the organizations that have received the good capacity, they will be able to contribute to getting this country to zero. So I'm so glad that Liverpool Health has been able to bring together 11 organizations. Imagine, what if we had 10 Liverpools who are with the 10 organizations there. Another organization in Mombasa is also building 10 younger organizations, and in Kakamega, in Nyeri, and everywhere. It will mean then that we will make an impact in this country in issues of capacity building, issues of accountability, issues of governance, issues of technical expertise. We will be able to improve. What I'm trying to say is the organizations that are here, you can make a difference. I think the modeling that Liverpool Health has done, you can also go down there and be a small Liverpool Health, isn't it? And be able to build the capacity of various organizations. I'm glad that you are here to celebrate, and one of the ways you celebrate is to really look at those achievements that have been made, and be able then to contribute into the in strengthening governance. Because issues of governance are very, very important in this country. As we get resources, and for now I know we need to mobilize our own resources, because the donors, you know the situation, I don't even have to go back to it. We are not having so much money coming in right now. So whatever we have, we should be able to be accountable. We should be able to have effective programs in the communities wherever we are. So I'm glad that we are going to recognize those whose organizational capacity has been built. And I know that today we are here to celebrate and recognize those whose capacity has been built on resource mobilization. That is very key, and we need that now. Because we might not be able to get so much money the way we used to, but if you have the skills, mobilize resources, I think even within the local context, our counties, you can be able to mobilize resources. So we are here to recognize those organizations that have been able to do that, whose capacity has been built towards resource mobilization. We are also here to celebrate communities and multi-sectoral engagement where you have also, your capacity has been built, and the issues of partnership. Initially, I remember when we started the response in this country, it's like an organization would tell us, but I'm the one working there, why is another organization coming there? What we used to say, you can never have enough organizations working in a region. What you avoid is duplication of the same service. But the services that are needed in the area of HIV are so broad that even if you are 3 organizations, you can still be able to work together, collaborate, have partnership, and then you'll be able to give an effective response. And I'm glad that today, as you celebrate, I'm glad that organizations are coming together, strengthen partnership, to be able to think about resource mobilization at a period when you really need to know how to sustain our response. We are also here to celebrate organizations that have now developed their information systems, their data management is powerful and is good, and you have been able to build capacity of organization. Liverpool has been able to build capacity through the Ungana project.